Aortic stenosis is a very common valve problem. It's the most common acquired valve problem that we see. And really the causes depend a little bit on the age and the patient. In older patients who are past the age of 75 or 85 years of age, by far the most common cause of aortic stenosis we see is just degenerative change of the valve. So after decades of use, the valve becomes stiff, calcified, and just doesn't open properly. And that's a very common problem among older patients. Another major cause that we see are people that have congenital valve abnormalities. So most people are born with valves that have 3 leaflets. About 2% of the population has what's called a bicuspid or a unicuspid valve, valves that just have 2 or maybe even 1 leaflet, and those valves tend to wear out faster than a typical valve, and so we see that as a common cause of aortic stenosis as well. I would say probably the final area that we see as a cause of aortic stenosis is people that have had radiation, patients that have had lymphoma or different types of cancer in their chest and received radiation at some point in the past. That radiation can be it can damage the heart valve just like it's damaging the cancer. And over decades after the radiation, that can lead to that valve becoming narrowed and not working properly. Aortic valve disease, even when it's severe, is usually tolerated by patients for a long time before symptoms develop. And the tricky thing about aortic valve disease is the symptoms come on so slowly that a lot of times the patients themselves don't really recognize that they're starting to slow down. Patients that just feel more fatigued during activities that a couple months or 6 months ago didn't make them feel fatigued, they get short of breath or tired easier, their stamina tends to decline a little bit.
If a patient has aortic stenosis and it's severe, and if they are symptomatic from that valve, then the valve needs to be replaced. Once a patient is symptomatic with severe disease, their life expectancy falls to 2 to 5 years. If a valve is successfully implanted, the patient will live a normal lifespan. In the old days, what we would do is divide the breastbone, put the patient on a heart-lung machine, open the aorta, and remove the old valve and put a new valve in. Nowadays, we can replace an aortic valve surgically through a minimal incision. We can either make a trapdoor incision in the upper sternum, or we can go between the ribs on the right side, and we can access the valve in that way and replace the valve. Since the advent of TAVR, which is transcutaneous aortic valve replacement, there are patients where we can make a small incision in the groin and enter a blood vessel with a valve that is crimped, and it is passed up the aorta and inside the old valve and then deployed open inside that valve. So it's really a replacement valve placed inside the old valve, and it works amazingly well.